everything that I have here is just scratching the surface of what my time, not just at Hopkins, but particularly these past 6 years as a resident at Hopkins and the Brady have been like. And my email will be at the end of this. So if any of you have any questions or just want to learn a little bit more here about stuff that I'm actually going to set a timer, so I try not to go too much over time. But this is, again, just scratching the surface of what it's been like for me as a resident. So just so we can get to know each other a little bit better. So I was born in New Britain, Connecticut. I traveled down to Virginia for college, where Dr. Clifton actually went to college as well. And I was a religion major. But when I was there, that's when I learned about the field of urology. I spent some time with private practice urologists in Virginia, and I just fell in love with the field. And from there, I came to Baltimore to go to Hopkins for medical school. So when I was a med student, again, like I mentioned, I had spent some time with urologists, so I had some idea that urology would be high up on my choice of specialty. So I started spending some time with the urology department as early as my first year of med school. I saw that the residents had an incredible surgical experience, that by the time they were PGY6s, where I am now, that they were doing cases by themselves or very proficiently with the attending and walking junior residents through cases. And I saw that they were busy, which as a med student was very appealing to me. In terms of research opportunities, so I, again, started doing research very early as a med student here. We have something called the Persky Fellowship, and I actually did mine with Dr. Olaf. I got started very early on, feeling like I was a member of this family, of the Brady family. I saw that the residents were very family oriented, and I don't mean that to say that they all like have children and families. I meant that they as residents were a family, like that they took care of each other. And I felt very at home with them. And the other thing is what Dr. Clifton just mentioned also is Baltimore in 4 short years became very much home for me. I looked at a lot of other places for residency. I really wanted to find somewhere else that topped Hopkins for me, and there really wasn't. I ended up ranking here first, and I didn't do it because it was comfortable. I didn't do it because it was home for me necessarily. I did it because it felt like the right place and the best place for me to train. And I don't know what the grass is like on the other side, but I can certainly say that these past 6 years have not disappointed with what I was expecting. This is me on my match day. So the early years, so junior residency is tough no matter where you are. I'll be honest about that, but we all make it through. And again, the best part about being here at Hopkins is there's a great group of people that you make it through with. This is just kind of a smattering of the cases that we get to do as junior residents at Hopkins. So in terms of like endourology, general urology, we do a lot of TURBTs, TURPs. We have a great infertility experience here, doing a lot of varicoceles and testes. Dr. Metlaga is a stone genius, and when you do your stone cases with him, you feel like you can do anything, and he's really the best person to learn from. So you get to learn a lot of stone disease, both endourologic and then also doing PCNLs even as a junior with him. I'm biased, I'm going into pediatric urology, but I think our pediatric urology experience here, both as a junior and a senior, which I'll get to later, is just truly remarkable. The amount of volume that we have, both in major cases like exstrophies and major augmentations and reconstructive pediatric urology, as a junior, you're getting in those cases. So honestly, as a junior being on peds urology, that's when my big open experience was as a junior, and it was incredible. But then of course there's your bread and butter cases, your hypos, your circs, your orchiopexies, and as the junior, those are your cases to do with the fellow. In terms of the robotic experience, so as a junior, I spent a lot of time bedsiding and was able to get a little bit of consult time. But like Dr. Clifton said, our experience has shifted a little bit now that we have that PGY3 junior chief experience. So for you all, whoever ends up matching here as a PGY3, you're going to get a lot of consult time. So you'll get a lot of very early robotic training, which, is just fantastic. So I had to just quickly add a little bit of this while I was listening to the other talks, because when I was a junior, I really only had the Bayview experience. Green Spring didn't exist yet. So Bayview as a junior is fantastic. It's your service. You run it. I'm the Bayview chief right now, and I'm there to supervise. I'm there for questions, but my junior that's there, he runs the whole hospital as the urologist there, and it's a really great opportunity to learn a lot of autonomy, to learn how to run your own service and how to deal with consults in a very efficient manner. We see a lot of general urology there, and we get a fantastic reconstructive urology experience. I spend a lot of time with Dr. Cohen, who's on this call as well, and it really, as the chief there, but also as the junior, it really amplifies your reconstructive experience. And then again, I didn't have this as a junior, but now you all will be able to go to Green Spring Station, which is where you learn those bread and butter cases of cystos and prostate biopsies, and just get a lot of repetition with those. As a junior, you also get to hold this beloved pager. And this is where all the consults, all the questions from other specialties in the hospital come from. Here at Hopkins, we see a lot of just bread and butter consults, things that you'll see everywhere, but we're also at Hopkins. So we see a lot of very interesting consults, from all different services, taking care of a variety of different problems. There are certainly some things here that I probably will never see again. And I'm very grateful to have had the experience here to learn all of that. You also learn a lot of bedside procedure skills as a junior resident, more than just, regular catheter placement, but cystoscopic catheter placement, suprapubic tubes, draining priapisms. By the time you're done with those 6 months as an intern on urology, you've pretty much seen everything. And so it's, holding this pager is again, this is one of the hard parts of junior residency. It can be a blessing because you learn so much, but it can be a curse. But again, we all get through it together. So after my PGY 3 year was the research year. As a resident here, you have not just the decision about whether you want to do laboratory research or clinical research, all the opportunities are here for you. I personally bend towards clinical research, but we've had residents who have done a 50-50 split of both, or 100% of either, and every mix in between. So for me in particular, I'm going into pediatric urology, and I have a special interest in transitional urology, which is what Dr. DiCarlo and Dr. Gearhart have an interest in as well. And like Dr. Clifton was saying, we have a very large exstrophy population here at Hopkins. So I wanted to capitalize on that and sort of try to better understand what the adult exstrophy experience was. So using our registry and an additional association, I administered a very large survey that asked questions in these domains, but many, many others. And some of the lessons that I learned throughout this year from a very qualitative data collection was that many of these patients are satisfied with continence despite not being defined as what we might define as continence. Many of these patients achieve parenthood, and many of these patients have satisfying sex lives, but there is a really high rate of sexual dysfunction in the adult exstrophy population. And I just have some of these on here so that you can see that we do, publish a lot of things during our research year. But I will say, in terms of research opportunities, the mentorship that we have here at Hopkins is unparalleled. You have a lot of independence to do what you want to do. I don't think any of the projects during my research year were really given to me. They were things that I wanted to learn about, things that I had questions about, and I was able to answer some of those. Many people work across disciplines and work in a very multidisciplinary fashion with other departments, which is a very big plus of this place. And the answer is always yes, meaning if you have a question, if you need money, if you need time, if you need anything, Hopkins can provide it for you. And I think I'm moving on to the chief years, but I do just want to mention that the research year, we've said that there's no clinical duties, there are administrative duties. And the research year is also kind of a time to pause, right, and take a breath. it is a nice year for that. And I think that I would be remiss if I didn't mention that. I was able to spend some time, on vacation. I was able to go to London to train with, or to spend some time with the person that I'm actually going to be training under for fellowship. I met my fiance, right? Like there's a lot of things that can happen during research year that doesn't necessarily end up on your CV. And then the chief years. So in senior residency here at Hopkins, we get very proficient in complex patient management. And this is where you really gain that true autonomy, both in and outside of the operating room. You develop, oh man, I'm gonna finish soon. You develop really great relationships with your attendings. This is just a quick list of the surgeries that we learned how to do in our senior residency, both robotic and open. And I will just put in a plug, like we do a lot of prostatectomies here at Hopkins. Like I know that that's something that that we are definitely known for. And as somebody who's going into pediatric urology, I love doing radical prostatectomies. That was the surgery that taught me how to use the robot. That was a surgery that I feel like the first major surgery that I could probably do, start to finish all on my own. So regardless of what your interests are and what you want to do, the surgical volume that we have here is beneficial regardless, right? It's all amazing, and we all have amazing surgical teachers here. We have major reconstruction that we do, a lot of implants, a lot of urethroplasties, and we also have a great experience with gender affirmation surgery. We help with the plastic surgeons here in a very significant way. Pediatrics, again, which is near and dear to my heart, is just an incredible experience. I haven't done it yet as a senior, but I can't wait. It's going to be like a little mini fellowship for me is what I'm hopeful for. This is where you get the opportunity to do cases skin to skin. And one of my favorite parts of being a chief has been being able to lead my junior residents through open and endourologic cases. Like was said before, is you really learn how to be a surgical educator here, because education is really paramount here at Hopkins. We also get our own independent clinic experience, which I wouldn't trade for the world. I think it's something that you really need to have in residency. And it's something that we certainly have here for you. So just to talk about the Brady family, the reason why I get up to come to work every day is because of these people. My co-residents, they're the people that I see the most in this world. I probably see them more than my fiance on most days. We get through the hard times together, we get through the good times together. So these are just some pictures of us. These are all from the Parton Pool Party, which is an annual event that's taken very seriously here. Just some pictures of us. I think the one on the right is me teaching needlepoint to one of our old attendings. It's already been mentioned about all the exercise equipment we have. The Peloton is a true highlight of this program, and we like to stay in shape here. And then these are some pictures of me operating with some of my co-residents, and then Russ and Biles, who are my two co-residents, who have become basically like my brothers these past 6 years. Again, I wouldn't trade these past 6 years for anything. I'm very, very grateful to have had this opportunity to be here. The future for me is I will be heading to Denver for the next 2 years to do pediatric urology fellowship. I'll be getting married out there in July of next year. And then after that, who knows, my fiance is from around here. I've loved it. So maybe heading back to Baltimore, and I could work with all of you. So the Brady legacy is really just that every opportunity is open after residency. No doors are shut at all by coming here. Everything is open. You graduate as a confident surgeon, an accomplished researcher, and a part of a legacy of excellence. And in my experience, you have a lot of fun while doing it too. So thank you for letting me share my experience with you. I'm sure there's a lot more I could have said. Again, here's my email though, if anybody has any questions or just wants to talk more.